At the turn of the 19th century in Minnesota, one historian noted, hospitals were few and far between. Consultation was difficult to procure, and laboratory diagnosis was hard to obtain. Although Minnesota had its first hospital in 1853, when St. Joseph's opened in St. Paul, smaller towns generally lacked advanced medical facilities. Within the profession, by the late 19th century, there was increasing importance given to surgery rather than simple amputations. There was also further use of anesthetics and the need for sterile surroundings. This created a need for extended post-operative care as well. In 1909, Dr. James Robertson, who had trained at the Detroit Medical College, opened the city's first hospital. He was joined by two sons, William and Archibald. The Litchfield Independent Review reported, "The hospital building, erected by Dr. Robertson, is so near completion that it will be ready for patients on Monday next, and several persons who have been on the waiting list will enter the building for operations. The entire upper floor is devoted to the hospital, and the arrangement of the various rooms is ideal in every way, both in the private and ward apartments. Each bed is supplied with an electric bell attachment for the use of the patients. The large operating room is no doubt one of the most up-to-date in arrangements and equipment of any in the Northwest. In the basement are to be found the laundry, kitchen, and dining rooms, which, however, are not ready to use." The Robertson Hospital made a difference. Just 1 month later, the newspaper noted, Mary Langerfeld was operated on Wednesday morning at the hospital for appendicitis and is doing nicely. Irvin Johnson was able to return to his home in Cedar Mills Wednesday after having almost a full recovery from an appendix operation 2 weeks ago. Joseph Walls, who had a similar operation, is expected to return to his home in Greenleaf this week. The hospital also opened new careers for women. Mary Pelly, a trained nurse, was appointed manager, and the Wilmer Tribune praised her, stating that she had made a marked success in her work in connection with the institution. The new Litchfield Hospital opened its doors the following year, and then in 1913 Dr. Robertson died. His hospital closed in 1915.